started. One quick reminder, if you're sending in questions or comments about anything being presented, please make sure that when you submit those via the chat box that you send those to all panelists so that everyone has the opportunity to see those and respond. And with that, I will turn it over to Val.
Okay, good morning, everybody. Thank you, Heike. What I wanted to start with this morning was just an update on testing. So we know that we've done a recording for our providers around the BINAC testing, and that is available. We're going to try to push that out a little bit more often. We're starting to hear from more providers that they're interested in the BINAC, that's the antigen, the rapid testing, and they do now have access to that. So we will make sure that recording is available to you. It walks you through the process of how you as a provider can get enrolled into BINAC testing. So another thing, testing is still really, really important. We can't stress it enough. We still test in our facilities, both as surveillance, and we unfortunately still occasionally have to do some outbreak testing. So mostly, though, I will tell you right now, our positives, both what we're seeing in the community and in our facilities, are in the St. Louis area. So we don't have positive activity outside of the St. Louis area right now, either in the community or, well, that's the greater St. Louis area is what I'm referring to. So that does seem to be, for us, what we're seeing in our data, where we're seeing, and again, low-level numbers, but still, if you were to compare those numbers to last year in April, they're higher than we were last year in April. So want to make sure that you guys understand, still low, but remember last year we were seeing very, very little cases this time of the year. Another question that we got asked about was kind of giving a budget update. So there is a lot of good news. I'm sorry, I have to cheat a little on this because I don't want to forget anything, but for my computer just had a hiccup. So I'm going to try to go off of, there we go. There we go. Okay, so what we know is that the governor increased our rate standardization money for residential providers to $49.9 million of general revenue, $146.7 million total. That equates to a 26.3% rate increase for a lot of our residential providers. Anybody who is at the fiscal year 2020 lower bound rate, and we've shown you those rates. If you have more questions, we can get that to you as well. So that is where the governor was. The House actually has, at the governor's amendment, and then with a separate pot of money, has put in an additional $7 to get us to the lower bound rate. It's close to $7 million general revenue. They did that, though, in a different House bill. They did that in House Bill 21. The Senate has not taken up House Bill 21. So I'm not sure what that means in terms of rates. So we're going to ignore that and act like that doesn't exist. And we're going to conference next week on the budget. So I think the two things that we need to be thinking about is we're going to be somewhere between the $49.9 million that the governor added and $59.9 million, because the Senate position was actually above what we needed to get to the FY 2020 rate. So they will put us right at 100%, a little above 100% of the FY 2020 lower bound rates. There's another thing that is important. There is language in the House version, so this is also going to conference next week, language in the House version that says that we must lower all rates that are above that 2020 level to on July 1st. And that affects about 16 of our providers who will overall see a net decrease in their revenues. The Senate does not have that language included, so that is a conferenceable item. So what I'm thinking right now in terms of residential rates is we're going to be somewhere between 97% and a little over 100% for the rate increase for residential providers. And the impact on our providers who are above that rate will be dependent on language adopted in the conference committee substitute. So we won't know the answer. I believe conference right now, I'm reading, is scheduled for next Wednesday. I know it can't be on Monday. So it'll either be Tuesday, Wednesday, somewhere in there. They still have to get these bills on the floor and voted off before next Friday. So by next Friday, we should know where we're at. The good news is, and I don't feel like I need to caveat this year the way that I always have before, we still don't know where revenues are. We're really good in the revenue side of things. So what I believe gets put in the House and the Senate is where we're going to be. I'm not concerned at this point, knock on wood, because big things can change that. But right now, knock on wood, we should be okay to start implementing this on July 1st. Now, those are not the only rate increases that are in the budget. So there are no COLAs for providers. Well, there is, I'm sorry. There's also a 5% increase in the budget for day service providers. And if Angie's on, yeah, she's on, she could put in the chat what all the service categories are for this, but it's day hab, it's employment, it's community integration, I believe. And if I missed that, Angie will correct me in the chat. But there is a 5% increase in the Senate, no increase in the House for these providers. So that's another additional increase that we have. And then I'm going to lean on just a little bit for this next one. But personal assistance also has a rate increase, and that is a 5.29% PA rate increase. But what we look at is per unit per agency. So for PA agency, that would be up to $5.28 per unit. For self-directed, that is an increase to $3.86 per unit. And for medical, that is $5.99 per unit. So both the House and the Senate have included that rate increase, but the House has a different funding source than the Senate. So I'm not sure where we will land on that. The Senate has used general revenue, and we all know we want general revenue and not special funding sources. So there is also a small increase for autism providers, and that is both in state plan and in the waivers. So those two will be, there was a good question. Does the COLA increase for personal care include self-directed? And yes, it does. But there is also, so there's also autism dollars in the rate. So I think that is everything on rates. The other really exciting thing on budget is that we have no wait list. So we have gotten all of the funding we need to not have a wait list. Now, we still have people that are waiting to identify providers for service, but we have the funding to cover them once we can get that worked out. Hoping that the additional money we're going to see in the residential rates and in the day rates will help support increase in capacity for services, because I know that's a struggle. Also, I know the struggle is not over. This gets us to an FY 2020 lower bound rate, and we know that in order to keep to be able to recruit, we're probably going to need to be able to pay more for our direct support professionals. So that's what I have on a budget update, and we will keep you posted. Next time we talk in 2 weeks, we should even have more really final information, but those are the big key decisions moving forward. So now will increase for autism services also include PAC funding? It does not. That is only Medicaid funded services. So if we increase, I think we have to make a decision as a division if we're going to increase the PAC funding, because if we do that, there's no more general revenue in the PAC pot. So that just means there's less money overall to go around. So that's something we'll need to talk about overall as a division. Do we want to decrease what's available to go around or not? And then I'm going to, now with that, we'll watch the chat for other budget questions. But in the meantime, I'm going to turn it over to Jess Bax, who is next, or not, 1 week away from taking over as your Division of Developmental Disabilities Director. But in the meantime, Jess has been working on the Vaccine Equity Committee, lots of committees. I don't want to say that's the only committee she's been working on with COVID. That would not be true. So you can also thank Jess Bax for PPE. I can't even remember all the committees we've worked on over this whole process. But she is also part of the Vaccine Equity Committee. So Jess, can you give an update on that?
Hey, yeah, absolutely. It's good to be here. It is probably, I think this is the last one of these meetings that I'll be over here at. So next time I talk to you at one of these meetings, I will get to be in my role at Developmental Disabilities. So I'm very excited about that. Can you hear me okay, Val? Or is there a delay?
You're good, Jess.
Okay, great. So yeah, Val mentioned the Equitable Distribution Vaccine Committee, and that's something that has a focus on ensuring equitable distribution of the vaccine in Missouri, and it has a special focus on the disability, aging, minority, and any underrepresented groups in the state. And so Department of Mental Health is on that equity committee. We also have MARF on there and the DD Council. And there are a number of task forces that have come out of that equity committee, including one focused on transportation, minority outreach, vaccine hesitancy, and then homebound and homeless. So a lot of work going on there, and their meetings and all of the information about that committee are on the COVID vaccine website. If you click on residents under the top row, you'll see equity, and you can click there and find all the information. But at the most recent meeting, they gave an update and talked about the FEMA COVID site, COVID vaccination site that's in St. Louis right now at the Dome at America Center, and talked about how it's open 7 days a week until June 1st, and they have the capacity for walk-ins and to do 3,000 vaccinations per day. So there was a lot of great information about that. We know walk-ins are always great for those who have vaccine hesitancy. Missouri Hospital Association was on that group and gave some great information about polling that they did about how people are, their attitudes and values toward the vaccine right now. One of the interesting, pieces of information they had is that individuals most trusted in the individual they trust most, entity they trust most to advise them on whether or not to get the vaccine is their primary care physician. So I thought that was an interesting piece of information about their polling. As far as the working groups, the transportation, there are a lot of resources out there to get vaccine transportation, and that's actually become a part of the website. So there is a get a ride portion of the website. It's also a drop down under residents, and it has all of the different resources available to individuals to get transportation to and from a vaccination site. There's also on the unhoused work group, they're getting ready to release a strategy guide with a press release in the coming 2 weeks on any individuals who are currently living in a shelter or maybe homeless and not living in a shelter, and strategies for how we can work to get them vaccinated. And they also announced that the Spanish version of Vaccine Navigator is up, so they're now focusing on other languages with that. And the other update from the group was the many different ways that you can find where to get a vaccine have been consolidated. And so now on the vaccine website at the very top, there is a link called Get a Vaccine, and all of the different ways, Vaccine Finder, the local listing, Missouri Vaccine Navigator, and the mass vaccination events, which were all separately housed websites, are all consolidated links under that Get a Vaccine link, which is nice for those of us who don't have to chase that around. So I think that's all I have, unless anybody has any questions.
Val, I think you have frozen. Yeah, we've lost Val for a moment.
Nope, I'm back now. Sorry, that
Okay.
was my fault. I said lots of really great things. So our systems are like connecting and disconnecting, so I've been disconnected twice, but I think I'm good now. So if we do drop off, let me know. There is a question in the chat. You're on mute now. I'm frozen. Thank you. I know. In terms of releasing all slots on the wait list, do we know what this means for timeline, ability to approve new waiver requests? So we know on the residential side that they are able to approve those now. On the in-home side, we're still going down the list. So we're doing 12 through 10s now, and then we'll do 9, 8, 7 as we clear those off, because we want to make sure we get our most need, and it's connecting again, so watch out. So anyway, that was another good question on the wait list. Before we move on, we're going to move on now in vaccinations, and I'm going to tee this conversation up. Remember last time we talked, we showed you our vaccination data. and we showed it to you by type of service you're getting, by region. So Carrie Tessero, who I'm introducing here, is going to start working with local public health agencies and sharing this data. And so Carrie, I turn it over to you, and then you're going to turn it over again. Thanks.
Hi, Val, thanks. So yeah, as Val was saying, last time we talked, we shared the data with you as far as the vaccination rates among DMH-DD participants throughout the community. And so where we're sitting, or where we were sitting with that data as of April 12th, is roughly 42% of individuals have initiated vaccine within our DMH-DD community, and 30.6% across the board have actually completed that vaccination. And while those numbers are good, we are happy to see people reaching out and getting that vaccine. They are not to the level that we need in order to get to herd immunity, which is believed to be somewhere between 70 and 80%. So we do have a long way to go within our own population and our communities. And the other thing I want to make sure we don't lose sight of is, once not accounting for age, we all know that COVID-19 has the biggest impact on those who are ages 65 and over. But aside from age, the next group that is most impacted by COVID-19 is that for having the worst outcomes, including hospitalizations and fatalities, are individuals with intellectual and developmental disabilities. And so it's really important that we get that message out and that we work to make sure everyone we serve knows that they are eligible to get the vaccine and how they can access it, and that they have really good factual information about all the different vaccines. And so to help us do that and improve these numbers, we have reached out initially to Springfield Green. We shared our same data with them that we shared with you all on the call last time, and they have readily agreed to work with us and to work with all of you in helping bring vaccine to these individuals, or helping them find the easiest way to access vaccine for both the folks in our communities that we serve, as well as for the people who are serving them. So Erin Sakura, I believe is how you say that, from Springfield Green, is on the line with us today and is going to talk a little bit about the process and how they see their ability to interact and help us with this endeavor. Erin?
Yeah, thank you. So I'm Aaron Shakura. So I'm the vaccine outreach coordinator. I lead our outreach team here at the Springfield Greene County Health Department. And we're also sort of serving as a regional hub for Region D. So if you fall in Region D, I'll have some resources specifically for folks in this area. I just want to say, we really appreciate this data being shared with us. We're excited to be able to try and get some of these rates up, to get some of these rates up with some of these resources and work with y'all to reach this population that is being severely impacted by COVID-19. So to kind of jump into it, just I can keep it pretty brief, but pretty informative here. We have 3 different ways that we can work together to get folks vaccinated. So our kind of our top way, our number 1 way here that's been available for a while now is our mass vaccination clinic that we're doing in partnership with Jordan Valley Community Health Center. That is here in Springfield. So folks with transportation, or those that are nearby that can utilize that state transportation resource that was mentioned earlier, which has been really fantastic. That's a really good option. We have seen quite a few individuals from some of the partners on this call that are receiving services come through that clinic. It is ADA compliant. They can work so that way it's not such an overwhelming experience trying to go through the regular process. We kind of pull a nurse and bring them up front. If you have an individual with mobility issues, we can also, in some rare circumstances, do those vaccinations in the parking lot if that is a need that's identified there. So those vaccination dates are all in Vaccine Navigator. So using that state resource to get signed up for an appointment is going to be the best way to access that. So if you have clients that's going to be the best option, all you need to do is send them to Vaccine Navigator and help them utilize that resource through that channel. The other 2, to help reach individuals that are that that's not the best option, there are other opportunities around the community. We've been pushing, working to really get all of those on-site like clinic opportunities in Vaccine Navigator, so that way it's most accessible to everyone. And we've been pushing the LPHAs in Region D to do the same, just because that is such a great way to consolidate all of those different opportunities for those that can get to them in one place. So if you do fall in this Region D area, there should be a clinic opportunity that is accessible as far as location and region. And if not, feel free to reach out and we can get you in touch with that LPHA to try to figure out what is available in that area. Now, if you are working with individuals who are homebound, then we have begun going out to sending vaccinators to those homes to vaccinate those individuals. So all that you would need to do is in Greene County is get on our list, which all you'd have to do for that is giving our call center a call, which I'm putting the number in the chat. So this is going to be an option primarily for those in Greene County. If you're not in Greene County, you can call your local area agency on aging, and some of those are keeping those lists and connecting them with vaccinators who are going out to homebound individuals and vaccinating them. If you're in Region D and you're not able to find a resource to reach those homebound individuals, feel free to give us a call and let us know, and we can try to find a good channel for those homebound individuals in your area. And then the opportunity where I think we have the most ability to work together is actually just going to be to set up specific opportunities to reach your clients or to reach groups of clients from a variety of different service providers. So we are actively looking for opportunities to make vaccine more accessible, especially for vulnerable populations. So I'm going to, after I'm done, I'll throw my contact information into the chat as well. If you are working with if you're a resource here in the Southwest Missouri region and you're looking to set up a clinic, please send me an email or reach out to me, and we would love to either set something up directly with your agency specifically for your clients in a location that's going to be accessible, or where they're already accessing other services to make it as convenient as possible. Or we can set something up that's really targeting this entire population and invite find a facility that's going to work and be accessible and reachable for a large number of clients from a variety of service providers, and do something that way. So we're open to discussions about either. We're utilizing a lot of different partnerships here locally with Mercy, with Cox, again, still with Jordan Valley, as well as with the National Guard, while we do have that resource available from the state. So we do have some capacity now. So sooner is better for everybody, because those kinds of things can change. And I know this is something we could execute pretty efficiently, pretty quickly, looking forward, into May or early June, if we wanted to put something larger together. And really, those are the three best ways to get individuals connected with vaccines. If anybody has any specific questions, or if there's a resource that I've missed that you're aware of in this area, please feel free to shout it out, and I can mention it. Or if you have a question, just let me know. Like I said, I'm going to put my contact information in the chat, so that way if that kind of thing is interesting, setting up that clinic, you can let me know. And if we do set something up with a provider and they're open to kind of opening it up to the larger community, this larger population, I do have the list of providers in this area, so we can make sure to send that information out to that contact list as well. And thank you for sharing that, DMH.
Hey, Erin, thank you. Thanks for getting on the call. Thanks for talking about all the cool things that can happen when you work together across different lines of effort. I do have one follow-up question, and I'm pretty sure I know the answer to this, but a lot of times we have direct support staff that will be accompanying individuals if they're going to a clinic, or if we're having a clinic on site. When you're talking about setting clinics up on site, of course, we're talking about doing that for the benefit of the individuals we support, but you're going to be open to vaccinating support staff or anybody that were to show up at those clinics. So I guess my point is if you're going somewhere to do a homebound clinic, you're willing to do more than just the homebound individuals there.
Oh, absolutely. The more people, the better, the more shots we can get in arms at one time, the more efficient they are. So we're talking support staff. If they're in non-residential programming, we're talking other household members, anyone who's eligible that's connected to that person. If we can get them vaccinated there, let's do it. Because then that protects this population as well, if it's individuals that are interacting with our folks with intellectual and developmental disabilities. So we want to create a layer of protection around them, not just by vaccinating them, but by vaccinating everybody in their lives.
Thank you, Aaron. Thanks for taking a part in the call. And please, everybody know, we brought Springfield Greene County on today, that we're trying to make these connections across the state. So this is a limited opportunity, but wanted to kind of demonstrate on how that conversation can happen. Okay. Carrie, did you have anything else you wanted to add?
Yeah, just real quick to follow up, like Aaron mentioned, we did provide Springfield Greene with a listing of our providers in that region, in that area. So he does have your information, but please don't hesitate to reach out. We will get you his contact information. As he said, he'll get it in the chat. But we absolutely want to take advantage of this wonderful opportunity to try and make it as absolutely convenient and easy as possible for our folks to get vaccinated. And as Val and Aaron were saying, all of our folks, not just the ones we serve, but the people who are working to serve them, as well as their family and friends, or anyone who wants to come along for the ride. Happy to vaccinate them all.
And I didn't, oh, sorry. Just real quick, that call center number I threw into the chat before, the 87412, I mistyped that. 1211. Excuse me. That number is also for our regional call center that we've thrown up for Region D. So if you're in the Southwest Missouri region and just trying to get somebody connected with an appointment, you're having some issues with the online system, just give that number a call and they can walk you through the process and get an individual signed up that way in all of Region D.
All right. Thank you guys very much. Thank you for the time, Aaron. Appreciate you joining our call today. I did have a question in the chat. Is there a place to report complaints regarding vaccination administration sites? We'll send out information that we have on that. So we won't address that in the call today, but please look for that in our follow-up information from the call. I'm going to turn it over to Leslie now. She's going to give us an overall update on where we are with our waivers. For those of you who may not remember, our two largest waivers are up for renewal effective July 1st. So there's a lot going on right now. Leslie.
Thanks, Val. Yes, there sure is. And we continue in informal requests for additional information on the comp and CSW renewals, as well as the partnership and MOKIT amendments to align with those renewals. And we just submitted a Partnership for Hope waiver amendment to Mo HealthNet to increase Factor C or waiver slots from 2,500 to 2,875 for waiver year 3 or fiscal year FY21, which is what we're in right now, effective April 1st, 21. So that's currently being reviewed by Mo HealthNet before submitting to CMS. So we have a lot going on. We have also submitted the Appendix K amendment to add the health assessment and coordination service. So that is currently being reviewed by CMS, and they are asking questions. So we are currently working with them for that. And we have also posted, I'm going to ask Heike to navigate to this chart. We have posted a COVID-19 flexibility authority chart, which depicts the authority for each of the COVID-19 flexibilities currently in place. And as she's showing you, that was located on the DD coronavirus information webpage on the DMH website. It's the third accordion, or it's the DD provider specific guidance accordion. It's the third document from the top. And that lists not only for Division of Behavioral Health, but also Division of DD. So that's a really good resource you might want to check out. And that's all I've got.
All right, thank you, Leslie, for that update. We're moving now to the last subject on the call. We're going to have as we promised, StationMD is going to be a part of, we do have a complaint in the complaint hotline for COVID. Thank you, Jess Bax, for putting that in there. So there is an answer to the question on who do you send complaints about vaccination sites. So pays to have the lady from Health and Senior Services for one more week on the call. Finally, for today, we're going to work with StationMD, and like we said, we're going to have StationMD on these calls as we go through kind of the next quarter of or a couple of months of COVID. But we want to remind everybody that StationMD is not just because of COVID. They are going to be a service that we have that is here to stay. We are working on a waiver amendment approval right now. We have funding in the budget to keep them in the system. That did not go to conference. That is final. And like I said, we're working with CMS to get it waiver approved. So we value what StationMD brings to the table in terms of quality of service, what it offers to the individuals that we support, how it helps our hospitals, how it even helps our primary care providers. So turning it over now to StationMD, they're going to do a little demo today on really how easy it is to access this service. So StationMD, take it away. You all are on mute still, I can tell that.
Okay.
Now you're good.
Can everyone hear me okay now?
Yep, we can hear you now.
Okay, great. Yeah, for some reason it keeps bouncing back and forth. Sorry about that. So yeah, first off, I wanted to start off just saying that everybody that's a Medicaid waiver participant is already been pre-registered to some, by the state. So there really is no official registration process. We have the information from the state. So I'm going to kind of walk through the process of, how you kind of contact StationMD, but people can do that. But, basically, if you have an issue with an individual when you get back to a home today and you need to call, you can give us a call. There's nothing that you need to do, additional on top of that. I'll kind of go through some processes after I kind of walk through the process about if you wanted to have some additional communication back with regard to the physician notes, some information that we would need from you in order to get that. You can certainly also communicate that when you make the call as well. So I'm going to share my screen here real quick. A little bit. So the process is really a pretty quick and easy process. There is the first part of the process is really just to make a telephone call to the 877 StatMD's number. The reason for the phone call is pretty much everybody can make a phone call and nobody needs to be nervous about the technology piece. So they basically can just give us a call. That we'll kind of walk you through the process once you're on the call. You'll be asked for some specific information, the state that you're calling from. If you're calling from an agency, they're going to ask you for the agency name, the address of the home that you're at, the individual's name that you're calling about, so that we can kind of verify them with the information we have from the state, which would be like their date of birth and their name and their address. The reason that you're calling, if you have their primary care physician information, and if you happen to have their most recent set of vital signs, we would ask for that information as well. So then what would happen is we would be putting that information into our system. If you have not used the StationMD app before, we'll kind of walk through the process of downloading the StationMD mobile app with you. The first time that you use it, you'll have to put a passcode in. After you do it the first time, you won't have to put the passcode in. It will automatically just pop up for you. Once the doctor is ready to speak with you, then they'll just tell you to click the join the StationMD visit on the mobile app, and then you'll be in the communication with the physician. And we use a HIPAA compliant version of Zoom. So it's basically just going to look almost like this WebEx looks, but a Zoom platform. And the doctor at that point will kind of take over and go through the exam. They'll ask particular questions about the individual. They'll ask, some history of the individual, usually definitely the medications, allergies, that type of thing. They'll go through their exam. If they need help from the person on the other end, they may ask for assistance. Let's say someone might have had a minor fall. They may ask them to do a little bit of range of motion with that individual. Like let's say they need to move their arm or their leg. Let's say they're having belly pain. They might ask them to push on the individual's belly so they can kind of look at the facial expressions. But you don't need to be clinical in any way, shape, or form. I would say probably 95% of our calls are with caretakers on the other end that are just, either support staff or sometimes even mom or dad are at home. So they're not clinical people, so people don't need to be worried about that as well. And then what will happen is the physician will kind of just go through their exam and then say, okay, I think they have X, Y, and Z. Let's say they need to e-prescribe something. They'll ask you what pharmacy is the best to use. We'll put that into our system. We'll send an electronic prescription for the individual if a prescription is warranted. They'll kind of go through what the plan is. And then we have the ability to either fax a note securely, or I'll kind of go in a second on how we can, if you send us some email addresses ahead of time, we can actually route information automatically as well to individuals within your organization to get an email notification once the physician signs their note, so that you have that ability. We also do have the ability, if you have an electronic health record through your agency, we're happy to, if you give us access to that, to put the notes right into that electronic health record as well. We do have many agencies in Missouri now. I think Therap is probably the most popular. So we have many agencies where we're putting the notes in Therap, and we also have access to the individual's history in Therap, which is very helpful, because then the doctor can kind of get that information through Therap too. So the other thing I did want to just talk about real quick, if is just kind of just some ideas about when to call, so people maybe don't really understand about when to call StationMD or what would be needed. So I was just going to go through that real quick, if you don't mind as well. So just some thoughts about when to call StationMD. And I would just say, as a rule of thumb, that anytime that you do not have to call 911, anytime that it's not a life-threatening emergency, you can feel free to give StationMD a call. So there are going to be things that are going to be quick and easy, like your rashes, pink eyes, falls, even oral health issues. And when we can't pull teeth through the platform, but we can keep the individual comfortable until you can get to a dental provider. And those things always tend to happen on like Friday nights or Saturdays, and you're not going to be able to get that person to a dentist until Monday or sometimes Tuesday. So we could potentially get them started on some antibiotics and at least keep them comfortable from a pain perspective until you can get them to a dentist. And those will be quick and easy things. You'll go through that process of calling just like we just talked about. The doctor will do their exam. Let's say it's pink eye, they'll prescribe some antibiotics. That whole process will probably take about 15 or 20 minutes. And then you have things that might be a little bit more involved, like vomiting, fever, cough, shortness of breath, constipation. Those are also things that are, more than appropriate to give StationMD a call about. But it could be that, let's say you call for a fever, the person seems stable. The doctor says, okay, let's give some Tylenol or some Advil. But they're a little worried about the individual, so they may want to ask you to do a follow-up, or they may want to say to you, okay, we're going to give you a call back in 2 hours or 4 hours just to check in and see how the individual is doing. And then if they give a call back and let's say the person's fever has come down, they still seem stable. Okay, great. We're fine. Just call back if you need anything else or if anything changes. But if they call back and the fever hasn't gone down with Tylenol, the person's vitals may be a little bit unstable. At that point, they may say, hey, you know what? I think we might need to transfer to the ER or to an urgent care to get, an additional workup. And if we do have to do that, we'll talk to you and figure out where you're going to be sending that individual. And we'll call that ER or urgent care and kind of have a doctor-to-doctor discussion. The reason that we do that is, number one, we try to expedite the visit as much as possible so that the staff at the ER have the history of that individual. And hopefully, if they know what's happening, they'll kind of just get the person in and get them out as quickly as possible. But we'll also communicate to that staff that, if there is, if you have any concern or you're on the fence about admitting the person, we can definitely check in on that person. If you do discharge them every couple of hours once they get home, or every day, or whatever, whatever the care is needed. So that we really do find that does help to expedite the visits in many ways. We can't always guarantee it, but we do find that it helps. The other thing that you can give us a call about are behavioral changes. Certainly if someone is going to be a danger to themselves or others, we wouldn't have a choice but to transfer them to the ER. But all of our doctors do have specialized training to care for individuals with IDD. Most of them are also board certified in emergency medicine, so they're very used to working with behavioral issues. So they're very, they're able to do a lot of de-escalation techniques to kind of get that person kind of back to baseline until you can get them to see their psychiatrist or psychologist. Also if the person is taking some medications, we could potentially do a PRN, an order for some of those medications, maybe increase the doses until they can get to their primary, to their psychologist or psychologist as well. So there are a lot of things that we can do from a behavioral perspective to try to keep that person at home as well. And there are also just, your other things. Obviously, COVID is a big one. It is getting a lot better, so hopefully we'll continue that way. but allergies, any, really anything, like I said, anything that is not life-threatening, you can feel free to give StationMD a call about. And then just some other things that are not necessarily emergent, but can be time-consuming from a staff perspective, and can cause some issues. Is we're also happy to do any kind of medication refills as well. I do have an asterisk there by your psychotropic meds and controlled substances, only because those would be on a case-by-case basis. But we will certainly work with you, to get that prescription refill. We certainly don't want someone going without or having to go to an urgent care or an ER to get those medications refilled. Also, any kind of order clarification. So if someone does get discharged from the hospital and you're not really sure what the orders are saying, you can call StationMD. The doctor will review it with you. If somebody, misses a dose of medication and you want to know if you should double up or just wait until, the next time they're supposed to get it, those are also, perfect things to call about. It's nice to see that some of the day programs are kind of opening up now. So if people are out sick from the day program and they forgot to get a return to day program note from their own doctor, you can give us a call. We're happy to do, a visit and give a return to day program question, note. And really, I just want to, I really want to emphasize any kind of questions or concerns, people really should just feel free to give StationMD a call about. We're really happy to help with it. And it doesn't even necessarily have to be directly related to an individual at the home. I think COVID is a good example. We had many caretakers that were calling just with kind of general, general questions and concerns. The doctors are happy to help really in any way. So don't ever hesitate to, to reach out to us with any kind of questions or concerns. Nothing really is too insignificant. We would rather have you call than not have you call, especially, even if you just have the caretakers really know the individuals the best. And if you just have a feeling that something is not right, or someone is a little bit more lethargic or a little not eating as much or just don't seem themselves, if you give us a call on the first day that you see that, we have a lot better chance of keeping that person at home as opposed to waiting till day 3 or 4 and then they're too sick and they're starting to get septic or whatever the case may be, and then we don't have any choice but to transfer them. So I would always, err on the side of giving us a call. And those are just some examples, but again, not an inclusive list, but just some examples to get people started. So that is kind of the process. And like I said, you don't necessarily even need to have the staff trained. We have many people that call that have never used the system. It is an app. It is pretty simple. We do have very different ways in which you can get trained if you wanted to, set up training for the staff, and we're more than happy to do that for you. I'll just put some options up here. There have been written instructions that have been sent out. We're always happy to resend those. We also did send out a link to a training video. We also have open practice sessions, 3 days a week that people can call and just do practice calls. And we can also do remote training with about 24 hours notice. So if you're having a staff meeting or you have orientation for new employees, we're happy to join that and give people just a quick overview and how to use the service. The other part that I wanted to point out, and I don't want people to kind of get overwhelmed with paperwork, is that we do have this Excel file as well that we would send if an agency wanted to really get more specific communication. So this the first tab kind of goes over just specific agency information. It kind of gives us an idea of who you want from an agency perspective to get notified if somebody is seen. So a lot of times at an agency, you might have a group home, like a manager for the particular group home, and then you have a director for the overall agency. So sometimes that director or even the quality assurance person for the agency might want to get a notification every time somebody is seen by StationMD. And then you may have just people that you would only want to get notified if they were managing that particular home. So on this tab, you would put the people that, from an agency perspective, that you wanted to receive the notifications when somebody gets seen. And we also do monthly reports to kind of just give a summary of the data of who gets seen by StationMD, so you can give us that information. And then here we just have, if you wanted to have specific information by each individual home within your agency, you would just provide us with the contacts for those homes, and then those people would get, as I said, an email notification every time somebody was seen at that home. And then they would have access to our platform, which is called Station Connect. And those notes would always be available for those individuals within our platform. So I can also just kind of show you what the notifications would look like. And it's just kind of a nice like push system for people. So they would get, as I said, as soon as the doctor hit sign, they get this notification that somebody was seen. They would log into our system, and then they basically have access to, they would see the site that the person was at, the name of the individual, and then they would just click on here where it says progress note. I'll make this a little bigger. And they would be able to see the note. And this would always be available to people, and they would have access to this, at any time. It's even nice if you have an electronic health record like TheraP to get that push notification, because then you're not having to like scroll through TheraP to see who was seen. You have a push notification, and then you can go in and see the note in TheraP if you prefer. So I know it's kind of a lot of information, but I just want to emphasize that it is actually a pretty simple process. And we do have many people that haven't had any training, and they just give a call and we kind of walk them through. And again, really don't need to do any kind of registration piece up front. But we, again, are more than happy to do any kind of training with your staff, or have just a one-on-one meeting with each of the agencies if they, want to get more detailed information or have specific questions that they want to bring up. But also happy to answer any questions now as well.
All right, thank you, Megan. We did have a question in the chat, but I think it's more for me than for you right now. That question is StationMD available for individuals served through DBH or just DD? So it is currently just available for individuals served through the Division of Developmental Disabilities, although we do sometimes have people that are served by both divisions. So in that case, yes, but you have to be enrolled in a waiver right now. So you either need to be in the Partnership for Hope, the in-home waiver, or the community support waiver, or the comp waiver, or the Lopez waiver in order to access the service at this point. We will be looking at ability to expand services here, but right now that's our limitation at this point. But and I just wanted to say, Megan, every time I listen to you guys talk, I learn something new, and I hope everybody else on the call did too today. But I just, knowing that I learned something new on that call just tells me we have to keep getting this information out in front of folks at different stages. So speaking specifically to my staff that have joined the call today, if you can think of a place where we need to be pushing this information more, please let us know, because we're paying for this for everybody. We're paying for everybody to have access to this. So we want to make sure people are utilizing it when it makes sense to utilize it. Anything else, StationMD?
No, I don't think so. Someone was just asking me for my email address, so I'm going to put it in the chat here so everybody has it. Or I can send it out. I don't know how that's going to go. Did you just? So yeah, so that's fine. Yeah, we'll get that information out so people can give a call if they need to, and we can set up some individual meetings.
Absolutely, and we will also make sure we put it. We will also make sure we put that in the follow-up information that goes out. So Megan, thank you so much. Thank you, team from StationMD, that were able to join today. Thank you. I already have comments coming into the panelists on what we can do to get more information out about this. So appreciate that. And there doesn't seem to be anything else in the chat. We did not have anything else on the agenda at this time. I can't leave the call without saying, we talk about vaccinations all the time, and I talk to people that are still scared about getting the vaccinations. And what I always tell them is, we're here to meet you where you're at when you're there. So if you've got a question, maybe I can answer it, maybe I can't. But I just want you to feel as comfortable as you can in the process. And I ran into somebody just last week who said, I know what I have to do, but for some reason, I can't walk through the door and get the vaccination. And she actually works within walking distance of a walk-in vaccination clinic. So I said, well, we're here to help you. And so I do think we have a lot of folks out there that are at that point, and I get it. This stuff is scary, but I told her just what we're seeing in the facilities that we operate, and we still have staff that test positive, and we have facilities that are 100% vaccinated for their residents, and we are seeing no negative outcomes. And I remind folks that when I'm talking about individuals who have fought a lot of things their whole life and who are successful right now in not catching COVID. So just wanted to make sure everybody had that. To end the day, enjoy the sun, and we will talk to you all in a couple of weeks. Thank you for everything you do. Bye.